This is CN8, the Comcast network. Now, real health and medical advice you can use with Dr. Donna Willis. This is CN8 On Call.
It's not just women any longer. Men are also changing the way that they look. In fact, cosmetic surgery is no longer a taboo in today's society. There's been a 175% increase in facial plastic surgeries in the last 8 years. Facelifts for men have doubled, and men account for 11% of plastic surgeries. Thousands of men and women are seeking medical solutions for changing their appearance, and 1 in 5 is a repeat patient. Tonight we're going to focus on your face. Joining me to talk about your face is Dr. Daniel G. Becker, the Assistant Professor and Director of the Division of Facial, Plastic, and Reconstructive Surgery in the Department of Otolaryngology, that's ENT, at the University of Pennsylvania Hospital. He's also the author of the book Rhinoplasty, a dissection manual. Well, that's a whole mouthful. Reconstructive surgery. People are just sort of becoming artists now with their faces.
Well, I think so. People are living longer and happier, healthier lives, and with advances in technology today and with what's available with medical care, people are interested in looking how they feel.
Looking how they feel, and part of that has to do with their appearances not only in relationships but on the job. There's some data that suggests that people who feel better about the way that they look sometimes even perform better.
Oh, there's no question about that, and I hear that from some of my own patients. I have one patient who had a facelift. She's a real estate agent, and subsequent to her facelift reported to me that she sold more houses in that month than she'd sold in the year before.
Beauty is one thing, and in the research for this show, it was just interesting that when you're looking at beauty, there's almost a mathematical formula for beauty, but there are also some tried and proven things that go back millennia, back to the Egyptians, Leonardo da Vinci. Let's begin by talking about how you analyze a face and the proportions of a face and the goals that you're trying to achieve as far as facial harmony.
Okay, well, when there are, as you said, time-tested ideals, there are proportions that go back to the Egyptians and to Leonardo da Vinci, and when we look at a face, when a patient comes in to see us, we look at them and see where there might be a divergence from these time-tested ideals. And often these areas are the very things that the patient seeks to correct. They often recognize that in themselves. So we would often look at there are, as you said, different mathematical ways to analyze things, just as Leonardo da Vinci did in his drawings.
And we have one of those drawings to sort of take a look at the face, sure. Because if people if they can get out their pictures, they can begin to sort of map out how their face is in harmony or out of harmony. Let's take a look at the monitor and describe what we're seeing there.
Well, what you're seeing, what Leonardo is trying to do in this picture is figure out the proportions of the face on the side view. So we know that the face can be thought of in thirds, from the hairline to the brow, from the brow to the nose, and from the nose to the chin. And as we get older, things start to sag and droop, and those different thirds go out of proportion.
Going out of proportion, let's talk about what begins to change as far as in the different thirds of the face.
Sure. Well, the first place to show signs of aging are the eyes. The eyes start to get wrinkles and excess skin, and also the brows droop. So with regard to the facial thirds, immediately the middle third starts to shrink and get a little smaller. The eyes start to look tired. Also, in men, the hairline recedes, making the upper third look longer. And so these are things that we see with aging and are very familiar with.
Now, we took a side view. We're looking at thirds on the side view. But when you look at front to front, the front part of the face, how do you begin to look at the proportions of the face in that regard?
Well, one of the most common ways is in vertical fifths. The face can be thought of as divided into fifths, each fifth about the size, the length of the eye. And so when those go out of proportion, then you see that, and the most obvious example is a patient with prominent ears. Many times patients with prominent ears have them corrected when they're children because it can be traumatizing when they enter first grade and and fellow classmates can ridicule them, but in adults sometimes it slips through and then later they decide they'd like to have that change.
Thinking about ears and thinking about a child who would have ears that are out of proportion, at what point in time, if someone does have ears that are out of proportion, should a parent think of that child having different types of surgery?
Well, usually that's done before they enter the first grade.
And as far as their growth is concerned, does that alter how the face or the ears grow?
It doesn't. You know, the ear has reached almost its full growth by the time children have entered the first grade.
If we're thinking about the beauty of a face, and we're thinking about proportions or harmony of the face, let's go through just again as far as the eyebrows, looking at the eyebrows, to the nose, to the cheekbones, to the lips, and to the chin.
Well, the things that we look for and that are signs of a youthful face are brows that are above the globe, above the, let me pick the right word.
Now, if you're talking to another doctor, so the
That's
globe
true.
you're talking about, we could even point
That's
them out.
right.
So eyes that sort of stay above where the glasses would be,
That's
the
right.
arch.
That's right. And we like to see high cheekbones. They are a sign of youth. We like to see full lips, typically a small nose and a small chin.
Now, are these sort of definitions of beauty, how do they relate to different ethnic groups, though? You know, not everyone is born with sort of a little nose or thin lips or cheekbones. Some people, if you're Asian, you have more of a round face than you would an oval face. So if we're talking about beauty and changing the aesthetic nature, what are the goals in that regard?
Well, that is actually an excellent point, and in fact, the goals are a little bit different. Our aesthetic ideals in Western society are derived from Egyptian and Greco-Roman backgrounds, and so those apply to most Americans. However, Asians are a group that particular aesthetic ideal doesn't affect. So.
And when you're looking at people from Africa and African Americans and even South America, is the whole concept of facial harmony still something, nevertheless, of what the proportions are, that there was harmony despite what the ethnic group would be?
That's exactly right. And in fact, the issues of facial aesthetics cross those ethnic boundaries, and the same general kind of proportions can be seen to hold true regardless of what culture and ethnic group you're in.
So the goal is not necessarily the little petite nose. We're just talking about when you're looking at the thirds on the side of the face or the fifths across the face, you're talking about harmony, how things are in proportion.
That's exactly right.
And when people begin to sort of look at their pictures, they can almost decide what it is that they would want to achieve with regard to these surgeries.
Usually the patient knows exactly what needs to be changed.
And when the patient makes a decision what needs to be changed, what would be the next step that they would consider?
Well, if it's something that bothers them enough, they can go see a plastic surgeon.
Are there ways for patients to get a good feel for what they could look like if they wanted to change?
There are. Most plastic surgeons now offer computer imaging. With advanced technology today, you can take a picture and change the face, and so you can give a patient a realistic expectation of what they might look like with surgery.
Okay, we're going to talk about that and more. Want to know how your face ages through the years and what surgeries can be done to maintain the looks you desire? Stay tuned after these commercial messages. You want to change the way you look? Have you looked at the proportions on your face? Is your face in disharmony? Well, that's the whole reason for facial aesthetics. My guest is Dr. Becker. We're talking about aging, Dr. Becker, and you know, you're going to age. If you stay alive, you're going to age. So that's a whole part of the process. But there are some things that can accelerate aging. Let's talk about those from the very beginning.
Well, smoking and sun damage, if you had to list the top two.
Those are the top two, smoking and sun damage. And if you sort of X those out, the face could last a little bit longer?
A little bit longer.
A little bit longer. Well, our first call is Carl. What about you, Carl? You want to change your face?
Hello, how are you?
I'm fine.
Hi, listen, there's a question I'd just like to ask. Is it possible to make somebody's mouth a little larger?
Larger as far as the opening?
Yeah, the facial look on the face is small, and they want to make it so that their expression, their mouth would be larger in some way to give a better appearance, like when you smile. And
okay, you want to do that yourself, Carl?
well, I've often thought about it.
You've often thought about it. You think your mouth is too small?
Yeah, I think so. It feels that way.
He thinks his mouth is too small. What about that? I mean, I'm thinking about, you know, we can inject lips, but you'd have to really restructure the face, wouldn't you? The bones and the muscles?
In general, to make the mouth larger would be more on the aspect of a reconstructive surgery and would be pretty difficult to do, I think, in general. That would be something that wouldn't fall in the range of a cosmetic procedure typically.
Typically. Carl, that's a tough one there.
Okay.
But if you wanted to inject those lips, we can
well,
do that.
No, I don't think so.
Okay.
I would just thought the thought of making it just somewhat bigger, so when you have that, like, smile like you have right now.
Oh, well, thank you very much, Carl.
You know, it's nice.
Okay. Well, thank you very much. You know, getting back to what happens to the face, you know, we talked about sun exposure. We talked about smoking. What about rest, stress, nutrition in the face?
I think those unquestionably all the things that contribute to good health, including good genes, I might add, that some people...
We've got to have those good genes, right?
You have to be a little lucky, too.
Have to be a little lucky. Well, getting back to what happens to the face over time, let's begin north on the face, and we'll move south. And what kinds of surgeries are available to change them?
Sure. Well, in the forehead, the things that you see changing is that you get deep lines and wrinkles. Mm-hmm. Those can be corrected with Botox. And I don't know if we should talk about that now, or should I go through the list?
We can go through the list, but Botox
Okay.
is one of those.
Okay. Then the brows also drop with age, just as the eyelid skin sags and creases form around the eyes. The eyebrows can be replaced to a more natural position with any one of a number of brow lifts. Those include endoscopic brow lifts and also some more traditional brow lifts.
I think we have some pictures of the eyelids. Why don't we just take a look at what can happen before and after? Describe what we're seeing here.
This is a patient with very heavy upper eyelids that make her eyes look smaller and also make her look tired. In fact, they're so heavy that they actually make her tired at the end of the day. They really weigh on her eyes. And so what you can do surgically is essentially remove that upper eyelid skin. That's cosmetic eyelid surgery or blepharoplasty. It's a fairly straightforward kind of surgery typically and is done often in our small office procedure room under local anesthesia or sedation. Okay.
Now, if the forehead, if you have the displacement of the eyebrows and the furrowing or the wrinkling of the worry lines in the brow, right, and then the eyes, what are some of the other things that change with time in the face?
Well, in the face as well, in the lower parts of the face, everything sags, unfortunately. The skin sags and you can have jowling, the cheeks sag, the soft tissue of the cheeks can sag. The nose also sags, and with aging we see drooping of the nose that can be lifted and placed back into position.
Yeah, I was reading about that, and you have to explain it to me a little bit about the tip of the nose and the changing, and you get a kind of a little hump in the nose as you get older. What's going on with the cartilage and the tissue in the nose?
Well, the cartilage and tissue of the nose just loses support. The tip of the nose is supported by the inherent strength of the tissue, and as it weakens, it falls, and that leaves the profile, creates an appearance of a little bump. And so that can be corrected by typically lifting the nose back up, the tip of the nose back up, I should say, and also typically filing down the bump a little too.
Now, you're talking about the cheeks and the sagging of the cheeks below the jawline, and that has to do with the ligaments that are underneath that sort of hold everything up. Those ligaments are being weakened, or?
Well, they do weaken with time a little, and they're fighting gravity day after day. And so eventually gravity wins, and the tissues will sag.
What about the ears?
Well, the ears get a little bigger, the earlobes get a little bigger, and in men especially, hair grows on them, and that can be treated with electrolysis.
When I'm thinking about big ears. You mean you become more like Mickey Mouse as you get older? The ears just get bigger and bigger and bigger, or Dumbo? Or?
If you look at people as they get older, the earlobes seem to get bigger.
Well, let's take a picture. Let's take a look at some of the pictures that you brought along as far as before and after.
This is something that doesn't occur with aging. This is just a patient who might have had this problem when she was younger and just didn't have this corrected, but it always bothered her. She never could wear her hair up, and her vertical fifths were out of proportion, going back to the issue about facial aesthetics and facial analysis. And she knew that. It was very easy to pick out. It was, again, an otoplasty is a procedure that reduces the prominence of the ears, prominent ear reduction. It's an outpatient procedure under local anesthesia or sedation.
And you can see it nicely how, with her hair pulled back, that the ears are more reduced in size so that she can have that sort of harmony. Again, I like that, the harmony back to her face. That gives her probably a sense of well-being. Thinking about getting back to the nose, and more people are getting that done than probably anything else. And, you know, we have some pictures of people who've had their noses changed just a little bit.
Sure.
Describe those operations and how you go about changing the contour of the nose.
Well, a nose is a complex thing, and each nose is different. They could look the same on the outside, and they could be different on the inside. And so we change the nose by recontouring the bone and cartilage underneath the skin, and then as the healing occurs, the skin over it redrapes on the new structure that the surgeon has built.
Well, let's look at this nose.
Well, this is a patient who falls more into the reconstructive category. She has a disorder where the cartilage of her nose was destroyed. This nose I rebuilt with rib cartilage and rebuilt the underlying architecture of her nose to give back the shape and appearance of her nose.
I mean, because it looked like it had been sort of damaged and destroyed. We have some other examples of what happens before and after as far as the nose is concerned. It seems to be one of the favorites for men.
It is. It's very common in men, especially after a career in sports, whether it be just as a high school athlete or college athlete or even professionally. Towards the end of their career, their noses might be a little beaten up, and they decide to have it taken care of. And usually in those patients, I like to wait until after they've essentially finished their career.
Okay, so if you're in sports, gentlemen, wait before you see these pictures. This may be you, before and after. Let's take a look.
Well, this is a fella who just had a big nose. This wasn't a sports injury, and he just wanted his nose a bit smaller. And we reduced the size of his nose again to bring it back into proportion with his face.
And you see there's not that little mogul, the little ski mogul right over it, and it is. The angle of the nose is back into proportion.
That's right. That's right. We're not trying to make the nose look unnatural. We want to make everything that we do in plastic surgery today is designed to create a natural, unoperated look, which is different from what it might have been in the past.
We have some video that you brought doing surgery, and I must warn you, viewers, if you have a weak stomach, this may not be for you to look. So just turn your head away. But if you have the constitution, viewer discretion is advised. Let's roll the videotape. This is Dr. Becker doing a nose job called a rhinoplasty. Let's take a look at it.
This is a device that's called a powered rasp that replaces a more traumatic and rough instrument to file down the nose. This when you're taking down that bone, the instrument moves very quickly and is very precise and allows you to just to take down the smallest amount of bone or a little bit more.
So when you're doing that, it looks quite painful if the person is sedated, but when you are lifting the tissue, you are looking for that bony cartilage to sort of smooth down.
That's right.
Okay, you made it through that. That's why I'm an internist doing television and not a surgeon. Get a little queasy here. But you brought some of those instruments here into the studio. Describe those instruments.
Well, what we are trying to do at the University of Pennsylvania is to create more precise surgical instruments so that we can do these and other kinds of surgeries more precisely with less trauma and bruising. To file down the bump on the nose, this is an instrument that was used before and is still used by some, and it's a rasp or a file. It's very rough, and I don't know if the viewers can see it in close-up, but it just is like a very rough file.
Right, and you can see here on this file how it is very rough, almost like a enlargement of what you would use to file down your nails.
That's true. And that would be used manually, and you can only be so precise with that. This is a powered rasp that does the same job, and you can see that the rasping surface is smaller and finer, and it's mechanized, so it goes at 15,000 RPM. That allows us to do things more precisely and to be very exact. And
because it does make a difference with regard to recovery. And we're going to talk about recovery just a little bit, but we're going to go to your phone calls. And Kathleen, you're on the air.
Hi.
Hi.
I have a 2-year-old who was diagnosed with a dermoid cyst on her nose, and we just went for an MRI at Children's Hospital, and we haven't had the results back of whether or not she actually needs the surgery. But I'm wondering if I should ask the ear, nose, throat surgeon if she should have a plastic surgeon close it, because it is a pretty prominent position on her nose.
When you say a prominent position on her nose, can you describe where it is?
Sure, it's right between her eyes, actually, right on the top of her nose. There,
so about right here?
Mm-hmm.
About right there. What do you think about that? It's a young child, and it is right there in the full frontal view.
Well, dermoid cysts are lesions that also sometimes have a neurosurgical component, and so they are often done in a team approach. And I know that Children's Hospital has such teams where a plastic surgeon or facial plastic surgeon and usually a neurosurgeon when it's necessary, and it's only in a small percentage of cases. In any case, so that's the kind of thing that typically a team approach would be undertaken, and I know that at Children's Hospital they have the right team on the case.
Terrific. Thank you very much.
You're welcome, Kathleen, and good luck to you. Parents are concerned, when the child has even an angioma, which is a blood vessel type, or a port wine spot, or any of those things, to make sure that the child doesn't get stigmatized before they go to school. Nowadays, do parents have more options?
They do. Nowadays, with the advances in technology and with a greater understanding of these kinds of lesions and disorders, they can get the best care possible because the team approach with all different kinds of disciplines coming together can really give them the best advice and the best care.
Okay. Coming up after this short break, we'll tell you how to select a plastic surgeon and more before and after facial aesthetic surgeries. Please stay with us. 2 to 3 hours and you can have a new look. That's what happens with a facelift, and men just as well as women are taking control of their appearances. We're going to go back to the phones and we're going to take your call, Patricia.
Good evening.
Good evening.
I'm an Afro-American woman,
All right.
and I am interested in facial plastic surgery.
Mm-hmm.
I know that in the past, scarring was an issue for people with darker complexion,
Mm-hmm.
and I know that there are new technologies and instruments. Is this still an issue?
That's a very good question. In fact, Dr. Becker and I, we were talking about it before we went on the show. Let me just ask you a few quick questions, Patricia. Any other medical problems at all?
None known.
Okay, no diabetes. That's the number one as far as tissue integrity. Nothing at all. What is it that you want changed?
Well, basically I have puffiness around the bottom of my eyes.
Mm-hmm.
And also, I'm in my 30s now, and my chin, I'm starting to get the double chin. Okay. So I'd like to have that, like, maybe pulled back.
Okay.
And my nose, I'm a little concerned about that because, as I understand, your nose continues to grow. And, as you age, it doesn't stop. That's what I heard. And it's already big enough, so.
I like the way you put that. But remember those, look at your photos, divide them, one eye length is how you divide it, 5 across, and then thirds on the side, and just take a look at your harmony. That's what I want people to begin to look at, your proportions, your harmony in the face has to do with 5 across and 3 up. And you look into it like almost tic-tac-toe and see if things are moving south or west or east or north. And then the proportions of that. But she's talking as far as an African-American woman, her concern, and as we talked about, is scarring, keloid formation. What are the approaches now in that issue as far as the repair, healing process?
Well, I think that for each individual patient, they know whether or not they keloid often. We see patients, and around the ears, some African Americans get terrible keloids, and those patients wouldn't be good candidates for facelift, for instance. Others don't seem to have a problem. There's never been a reported case of a keloid in the midface. And so a rhinoplasty, nasal surgery can be done without too much concern. Also, eyelid surgery is generally safe.
So we're talking here, Patricia, you said you want your eyes, your nose, and your chin. Eyes, nose, and chin. Now, one of the things I have to ask you, you're in your 30s. What about your family history? What do the faces look like as the decades go by in your family? And what about your overall fitness and health? Have you stabilized at the weight you want to be, or is there any shifts you're going to do with regard to that?
My weight is pretty stable.
Okay.
As far as the faces in my family, the noses tend to continue to grow. I mean, my aunt, my mom, that's an issue.
Okay.
I never thought I would come to this point ever.
Right.
But I'm starting to think about it.
Well, believe it or not, Patricia, you can't, they say the apple doesn't fall too far from the tree. It's the same with the face. It's the faces stay within that multiple generations. But there is some encouragement, as Dr. Becker mentioned, is that in the mid-phase, there's little less likely to keloid. What about yourself? Do you normally keloid?
I do scar. That's the problem.
Okay.
Like, I'm mostly in my leg area. My face it tends to heal itself quickly, but like my legs tend to scar very easily.
So when you had acne or anything like that in your face, did it cause any scarring or problems?
Well, it does scar, but it goes away fairly quickly. However, I've noticed as I'm getting older, they don't go away as they used to.
Isn't that a shame? I mean, Dr. Becker, she's talking about the fact that, when she had acne, that has not changed. So what are her possibilities?
Well, I think that for certain things, such as surgery beneath the chin, she needs to think about the possibility that she could have some scarring beneath the chin area.
Okay. All right. But as far as in the mid-face or getting her nose done?
That can be done safely. And the thing that's interesting about Patricia is that she represents what a lot of people are feeling now, is that they have heard a lot about plastic surgery and maybe they know someone who has had it successfully. Now it's not behind a shroud of mystery anymore. It can be done generally, safely, without too much fuss, and so more and more people are thinking about having it where they never would have thought about it before.
Even men, and that's what I like. Men are now becoming so vain. Like you, Calvin. Are you vain?
Yes.
Oh, good. Another vain man. What is it you want done to your face?
Well, Dr. Willis and Dr. Becker, I'm an Afro-American male. I'm 63 years old, and I inherited acne from my mother.
Oh,
and
okay.
I've had it all my life, and my sebaceous glands still secrete oil. And I've gotten scars over the years, and I was wondering if anything has taken place in terms of technology of removing acne scars.
You know, there are some techniques with regard to dermabrasion. How do you address someone who really may not need a facelift, but wants to change sort of the contour, you know, lasers? There are a variety of things.
There are a variety of things, and you've mentioned, I think, two of them already, dermabrasion and lasers, and then in between, perhaps chemical peels. Unfortunately, for darker skin, it is still the same problem that you can get blotchy pigment changes and scarring.
Okay, of the three, the peeling, the dermabrasion, and the lasers, which would be the best bet?
Well, whatever it is a light one of those. So either a light chemical peel or a very light laser. It's not exactly the modality that you choose, but it's that it would be very, very careful. There are many surgeons who won't do that kind of work on very dark skin, and because of the safety factor.
The safety factor as far as the aesthetic. You know, we're talking about trying to give you the aesthetic you want, Calvin.
Yeah.
Where are you on the spectrum of brown?
Well, I'm dark brown.
Okay. So you're like semi-sweet chocolate?
Yes.
All right.
Okay.
Okay, so the darker brown that you are, the more that you have to be careful. Because those melanin cells are very important little cells, and they can be very tricky. They don't like to be disturbed too much. And the chemical peels and the lasers and those kinds of things, if they're not done very carefully and lightly, you could end up with that smooth, semi-sweet chocolate not being as smooth and throughout the face that you want.
So I should leave it alone?
Maybe so.
Okay.
Okay?
Okay, thank you.
All right, you're welcome.
I enjoy your show.
Well, thank you very much.
Bye.
We're going to go back to the phones and another man. Jim. You're
Hello?
on the air, Jim.
Are you there?
Yes, I'm here, and so are you. You have a
Yes.
question?
Well, my question is, as I'm aging, I'm getting some dark blemishes on my skin. And I talked to my general practitioner, and he doesn't really know where to send me, and I don't know if that's something that I should see a plastic surgeon for, or if I should just go to my dermatologist.
Okay, how old are you, Jim?
62.
You're 62, and where are these changes as far as these blemishes occurring?
Well, mostly around my forehead and on my nose, and I'm kind of worried that I might have Zachary disease.
Okay. If you have something like that, the first stop would be a dermatologist to do a complete evaluation. If you've passed your internist, meaning that you're in generally good health, then as far as a skin problem, as far as some blotches or some other lesions that need to be evaluated, then a dermatologist can do it. A person like Dr. Becker, who is into facial aesthetics, if he sort of passes those sort of levels of evaluation and he wants to have something removed that's on his forehead that are aging spots or blotches, do you do those kinds of things also?
We do. Depending upon the kind of blotch that it is, a laser resurfacing can really do a nice job on those and rejuvenate the face.
There are options for you, whether it's the laser or some of the peels, and in fact we're going to do some more shows this month on different dermatological ways to rejuvenate your face. But that is a good call. Getting back to the differences, Dr. Becker, between men and women and facelifts, they're approached a little bit differently, aren't they?
Yes, they are. And I think that where the reason why they're different is because of the hairline. Men have sideburns and women don't in the same way. And so where you put the incisions are different. In women, you hide the incision inside the ear, basically. And in men, if you did that when you lifted the skin back, you would bring the sideburn onto the ear.
So it wouldn't really look right at all.
It wouldn't look so good.
So where would you cut along?
In the front, you hide the incision in a crease just in front of the ear. It's a naturally occurring crease, and it is well camouflaged there. People do not notice that crease.
That's interesting. And again, men and women, when they are approaching having their faces rejuvenated or put back into proportion. All of these things are sort of set out for them so that they know what choices that they have.
Exactly.
And what the results could possibly be.
It's true.
All right, we're going to come back to that and more healing, new techniques and tools that allow you to have a speedier recovery, what to expect after surgery, and more of your phone calls when we come back. Thank you. These are all facial aesthetic surgery types, and how do you select a plastic surgeon? Dr. Becker, how do you select a plastic surgeon?
Well, you want to be careful and do a lot of research. And if you had to think of 2 or 3 things, I think it is important that a surgeon be board certified. There are several very good boards and well-respected boards. They include the American Board of Plastic Surgery, the American Board of Facial Plastic Surgery, and also the Board of Oculoplastic Surgery. And these boards all produce very good plastic surgeons. Also, it's important that whichever the plastic surgeon is, that they are good at the surgery that you are interested in having, and so you should ask to see examples of their work.
That's very important because, again, in the research for this particular show, there are some people who are out of their league with regard to certain types of surgeries that they do. And so that person should not only have done the procedure himself that he's showing or she's showing you the picture of before and after, but they should do a lot of this and be certified or in the hospital to do these particular procedures.
Exactly.
I think another concern that I have is that, insurance companies don't cover this particular cost unless it's improving function. But cosmetic surgery is still out of your pocket. What are the cost factors, just the range of cost for plastic surgery?
And how much does a procedure cost?
Procedure from a nose to a face, or on average?
In the Philadelphia region, anywhere from $1,000 to $10,000, depending upon the kind of surgery that you're having.
Okay, so if you have an extra $1,000 or $10,000 and you want your face put back into proportion, you can have it done here in the Pennsylvania area, in most large cities, in most areas that have academic centers especially, and even good medical centers. We're going to go back to your phone calls, and we're going to take your call, David.
Yeah, how you doing?
I'm fine, David.
I got a question for the doctor. I got a 7-year-old girl. She has golden hair syndrome. I don't know if you're familiar with that or not. She had multiple surgeries already, and she had surgery last year. They did reconstruction of her whole face with a 3-dimensional mold. I don't know if you're familiar with that. Now they're saying they're going to do surgery again in March because her left side, she has no tissue there, and they want to put like a vein in there to build the tissue. What do you think about that?
Well, Goldenhar syndrome and other syndromes like it are very complicated syndromes, and just like the caller who had called earlier, these are the kind of things that about the dermoid cyst. These are the kind of things that require a team approach. And just on the face of it, from what you said, I don't know. I think that this would be the kind of thing that would really require looking at a record and really requires considerable thought. So I don't know about your specific question, but it's just important that you feel comfortable with the team that is treating your daughter.
You think it'd be like another opinion?
Well, second opinions are always helpful if you're on the bench, which means you're on the fence with regard to yes or no. It's very important to get the information and to make sure that it's clear in your mind, because you're the one that has to live with the consequences of it, and you're also the parent taking care of the child. And it's important just in how you relate to your daughter that the parents are very calm, because that's communicated to the child, and how the child does with the surgery and after the surgery requires your complete understanding of what they're going to do, how they're going to do it, and what the possible results are going to be. So take the time, write down all your questions, and sit down and have a conversation. And because you've been through this several times, I'm sure that they're not going to be put off by the fact that you want to think through this very carefully and really get very comfortable with the particular team of doctors who are going to be doing this. That's a very good call. You know, having a facelift, it looks like they're just ripping your face off. You know, we have some video of this, and we want to be very careful as far as the viewers. But if you've never seen a facelift done before, we're going to show you some of this, and Dr. Becker is going to explain a little bit of what you're going to see. So viewer discretion is advised. Let's sort of look at that tape, and let's let you take a look at a facelift. What's happening here?
Well, a facelift is, of all the facial cosmetic surgeries, one of the bigger ones. It's the biggest one. And so what you're seeing here is that the skin has been lifted so that the tissues underneath, the ligaments that you had talked about earlier, and the other tissues can be pulled back and resuspended to where they used to be 10 or 15 years ago.
So you're just sort of rehanging the face, tightening up what's been sort of let drag down in the face. And so they're pulling it back up to do what?
Well, once the tissue beneath the skin has been lifted and resuspended, then there is excess skin, and the excess skin is simply trimmed away.
Okay, so they trim that away and then just sew a nice little line.
That's right.
Okay, I don't know about you. I'm an internist, so that made me a little queasy. If you stayed with me, great. Marcia, you're the next call. Hello, Marcia.
So you have a few questions regarding my rhinoplasty I had done a month ago. I had a deviated septum, and he filed down my bumps. However, one has reappeared. I don't know if that is normal, and he said that it's usually normal. However, he wants to refile it until my bruising and my swelling goes down. Is this safe? Is it normal? Should he be going back in after a month?
That's a perfect question that leads into, you know, how does one know if they have to have something done again? Is it normal for someone to have to go back in to refile things down after a couple of months?
From time to time, you have to go back and touch up an operation. Typically, we would wait more than a month, but circumstances can vary, and it's hard to speak specifically about that. But usually, you'd wait at least 6 months if you could.
6 months to do that.
The reason why I would want to wait that long is because rhinoplasty, like any surgery, causes a lot of swelling. And so that if you want to make some precise changes, you'd like the swelling to go away before you then go back and make a change.
Talk about that. And in fact, Marcia, you had the surgery a couple of months ago, and you're not too sure that you want to do it so quickly now?
Right. I actually had it a month ago. In a couple of days, it'd be exactly a month. And I just don't know if I want to go back in and do it again, how safe it is, and if, do you know what I'm saying? It's just,
I do.
It's something so new, and I don't know if the swelling is going to go down to the point of where it needs to be. So I don't know. I'm just quite
And the reason why they're going back in is just to file down some...
It's another bump. It's not the same bump that I had from my deviated septum. It's another one that had reappeared. It maybe is scar tissue. I don't know if that's possible to have after rhinoplasty, because I don't know how it works.
Okay. Well, you know, Dr. Becker, again, you know, you say just to give it a chance for the tissue to sort of get back to normal again. Any other thoughts about what Marcia's describing?
Yes, these are good questions that you have, and your doctor should be able to answer those questions for you in a way that you can understand. And I think that's the most important thing, to maintain that rapport and talk to your surgeon and ask your surgeon the same questions, and that surgeon should be able to explain it in a way that you can understand it. And if it makes sense, then maybe that's something to think about. And if it doesn't make sense to you, then any surgeon would be more than happy to let you have a second opinion. So,
again, Marcia, I'm of the school, if you're not comfortable, that affects your whole body and your whole healing process. And confidence is everything when you're talking about any type of surgery, especially surgery on your face. So I would say go back to your surgeon, say you're not comfortable with it. Maybe you can take some time. It's not an urgent thing because this is an elective procedure. And let him go through each step. And if you agree, then you agree. If you don't, then you don't agree. And you can get a second opinion, okay?
Great. Thank you.
You're welcome. We're going to go back to the phones. And Lucille, you're on the air.
Hello.
Hi.
Hi. I had the eyelid surgery 10 years ago,
Mm-hmm.
and I'm thinking of having it done again. Is this like they do it a second time?
They can do it a second
And I
at a
have a
time.
second question also.
Okay, go ahead. Ask the second question.
Second question is my neck is kind of wrinkly. I don't like it. Did they do just necks?
Okay, she wants to know, can you go back after 10 years to have some touch-ups done again? Because, as long as you're alive, you're going to age. So how much surgery can you have on your face? When is the point you just no more?
Well, it depends, but gravity does work its magic every day, and it pulls on your skin and pulls it down towards Earth every single day. So over 10 years, you might expect that you would have some additional excess skin that might need to be removed around your eyes. And then as you get older, sometimes the skin beneath your neck can sag too, and if that's something that's out of proportion, then that can be addressed by itself. Sure.
Well, Lucille, the answer is yes, that it can be done. And again, it's having realistic expectations of what you want to accomplish. And I'm a big proponent of making sure that if you're smoking, quitting smoking, making sure your nutrition is up to par, and watching for that sun.
Right.
Because it just destroys the face.
Yeah, I'm fair. I don't go in the sun anymore.
Okay, Lucille, good
Okay,
questions.
thank you.
You so much. What are the do's and don'ts of facial plastic surgery? And are you a candidate for it? The answer to these and more when we return from these short commercial messages. There's some good information on Dr. Becker's homepage for all the questions that you might have. My guest is Dr. Daniel Becker, and he is the author of Rhinoplasty, a dissection manual. He's also an assistant professor at the University of Pennsylvania. And, there are lots of calls about the face, 175% increase. Let's go back to those phone calls because this is the last block of the show, and we're going to start with your phone call, Barbara. Hello.
Hello.
How are you?
Hi.
You're on the air.
I'd like some information on removing bags under the eyes. What is the safest procedure?
Okay.
And if it should be done by somebody who's trained in oculoplasty, or could an ophthalmologist do it as well? And can it be done under local anesthetic?
It seems like you've done some homework. Have you?
I have, yeah.
Where'd you get your information?
Well, I